Let me start by saying good afternoon, everyone. As stated, we are here today as the Philadelphia Police Department, under the leadership of our Commissioner Kevin Bethel, along with the District Attorney's Office, make an important announcement concerning a very troubling and, quite frankly to me, senseless incident that happened early Saturday morning in our city. And I was just sharing with the nurses that it was about 7 a.m. when I got the call from Kevin Mahoney alerting me to the tragedy. At that time, 3 nurses here at Penn Presbyterian Hospital answered an emergency call, and they were rushing to provide aid when a car pulled into the hospital emergency room area with a gunshot victim who needed help and care. Now, the brave men and women who you see standing behind me and the nurses I greeted on my way up, they were coming to the aid of a gunshot victim when suddenly a driver of the car, a Jeep, sped off, striking the nurses along with the gunshot victim as well. Now, one of the nurses, a 36-year-old man, suffered serious facial injuries, and he remains in critical condition. The other 2 nurses, a 37-year-old man and a 51-year-old man, suffered various injuries and are in stable condition. The gunshot victim, 28 years old, was also struck by the car, and he's being treated for all of his injuries. Now, Commissioner Bethel is going to come forward, and he's going to give you some particular updates about the case, but there are a few things that I need to share with you as mayor of this city. 1, now our frontline healthcare workers, it's important for us to pay attention to this, on the scene to care for a victim of gun violence are being struck by a fleeing car. This is totally and completely unacceptable to me and to all of us here in the city of Philadelphia. It's important for me to say out loud so that Philadelphia knows, and this is for every healthcare worker here at Penn Presbyterian and every healthcare worker in the city. I see you and I hear you, and we know what valuable services you provide to us on a daily basis, and it is our job to ensure that you are protected and safe while you do your jobs. And we are going to make sure that we do that. Second, let me be very clear. We are going to end this culture of lawlessness that has been plaguing our city, and it won't stand. Now, someone somewhere is saying that homicides and shootings are declining, but I want to be very clear that we have no intention on resting. If there is someone out there who believes that we are going to get weary in the midst of this fight, in this battle, and that you will wear us out, we stand unified with our members of our Philadelphia Police Department, all of our healthcare professionals, grassroots community-based organizations, our district attorney's office, all of the external partners who work with us and help us on a daily basis make the public health and safety of our city our #1 priority. So we will not give up. We will not give up, and we will continue to do everything that we possibly can, using every tool in the toolbox to make the public health and safety of our city our #1 priority. We're going to do it. I want to say to you, Commissioner Bethel, and members of your executive team, thank you so very much, sir, for your leadership. To the detectives who worked on this, to the rank and file officers who worked on this, and to all of our external partners, the district attorney's office who's present here on today, thank you. The city of Philadelphia cannot do this alone, but our partnership will ensure that we won't stop this fight until there is nothing else for us to fight. Thank you so very much. You'll now hear from our commissioner.
So thank you, Mayor, for your words. Let me again pick up where the mayor ended. we will announce, Commissioner Vanore will come up here and announce that we have approved an arrest warrant for an individual we have identified, and he will walk you through that. I do want to take this opportunity. When I woke up Saturday morning, I couldn't believe what I saw. I could not believe that in a community that I'm born and raised in, spent many a time on Penn's campus, what I watched this hospital and the nurses and the staff and the doctors and everyone here, what they do every day for this community, the lives that they save in this community, and the fact that someone had the audacity to run over 3 nurses and severely injure them. They have been on the front lines with us since the day I walked in the police department 38 years ago. Our nurses have been at the front line of supporting us and supporting this community. They take an oath to serve. They take an oath to serve. And when you watch the video that I watched today, it is shocking to see the disregard for their lives by these individuals. And so the mayor is absolutely right. We are going to be relentless in our efforts to stop this behavior. And so I also want to say thank you. My FBI partners here today, Jamie Milliken from Assistant Special Agent in Charge at the FBI, has been at the forefront supporting us throughout this, because we all collectively, as the mayor said, collectively understood, working with our DA's office, working with our Penn team, where Catherine, I know they're around here, and I see the chief here as well in the background. You know, we didn't do this work alone. Our Crash Investigation Division, all of us recognized that this was absolutely unacceptable. And so I'm just proud and honored to be leading this police department, proud of the work that Commissioner Vanore, me and him have been on the call, I think every other hour, trying to figure out where are we on this job. And so again, to the nurses who are here today and the medical staff that are here, I want to let you know we appreciate everything you do. Everything you do matters. Your work matters. As I say, the police department's work matters. And I just want to say thank you. And because here's the thing, ladies and gentlemen, when that happened, you know what these men and women did? They continued to treat the shooting victim, and he survived, at the same time treating theirs. That is the core of who they are, and that's the core of what we will respect. And we will ensure that this never happens again to the men and women who serve along the front lines with us. I'll stop here and I'll turn it over to Commissioner Frank Vanore. But when I do that, I want to personally thank him. From the time I got on the phone with Commissioner Vanore, he said, I got it. We're going to bring this job in. And so I'm just honored for him to be standing here with me, leading the men and women of our Crash Investigation Group, our Shooting Investigation Group, and all those other partners that he enlisted, even outside the city, other jurisdictions, to bring this job to a closure.
Thank you. Thank you, Commissioner. The Philadelphia Police Department is going to announce today that we have an arrest warrant for Jadir Goodwin, 20-year-old male, in reference to for aggravated assault, multiple counts, and other related charges. I'm going to let the district attorney elaborate on the charges. I'm going to give you a little bit of detail, as is what happened in the investigation and where we led us to gathering these charges. Early in the morning on Saturday, approximately 4 a.m., a shooting occurred in the 1300 block of Belmont. We now know through our investigation that a 2023 silver Jeep Cherokee left that shooting scene and came here to Penn. That car was occupied by 3 males and an additional male that was hit by gunfire multiple times. That male was in the rear seat. They parked right on this driveway where you're standing now. And the 3 males exited that Jeep Cherokee, went inside Penn's ER and begged and pleaded for help. And what happened? Those 3 nurses, along with security staff, exited that hospital and ran towards that shooting victim. They did everything they could to render aid, while others came out with a gurney. At some point, we now believe that the Penn police were alerted that a gunshot victim was here, and someone was en route here with lights and sirens to see what was to investigate. At that point, these 3 males who begged and pleaded for help jumped back in the car and recklessly and intentionally left this parking lot in a high rate of speed and drove right into the 3 nurses, their own shooting victim associate that they brought here, and continued at a high rate of speed away from this area. Now, after this, an investigation was begun. There was a scene here, there was video here. The FBI had called me, as Commissioner said, ASAC Milligan, along with Penn Police, we began an investigation. That investigation, that evidence, led us to about 2 p.m. in the afternoon to Upper Darby, a location Upper Darby, where we recovered that vehicle. All right, that vehicle was taken in police custody, and we were able to recover evidence from that vehicle, along with other video and witness information. And based on all that, we were able to develop enough probable cause to get the warrant. We are actively seeking the arrest of Mr. Goodwin. Anyone who knows his whereabouts, we're asking them to call our tip line, 215-686-TIPS or 8477, or they can call 911. He's considered dangerous, and we want to take him off the street. I'm going to turn things over to the District Attorney's Office to explain the charges.
Good afternoon, everyone. I'm Danielle Burkavage. I'm the Chief of Intelligence in the Gun Violence Task Force of the DA's office. We are a joint task force with the Attorney General's office and the Philadelphia Police Department. You've probably seen us a couple times, including Bill Fritzy, who runs our unit. This is one of those cases that we work on in collaboration with everyone. When this happened, SIG reached out to us, the police department, and we started to hit the ground right away, helping any way we could to get towards approving charges in a timely manner. We only could do that because of the amazing work that the SIG detectives did, as well as our federal partners. And we look forward to continuing to investigate this case, as this is not where it stops. As you heard, there's still a shooting that happened, and we are going to assist in trying to figure out who the original shooters are. What I did want to announce is the arrest warrant that was approved. I'm going to go through the charges. Again, that's Jadir Goodwin, Goodwyn. His date of birth is 12/29/2003. And the charges that our office approved and was signed today as an active arrest warrant is aggravated assault as a felony of the first degree, accidents involving death or injury, in this case it would be injury, aggravated assault by vehicle, which is a felony of the third degree, possession of an instrument of crime, a misdemeanor of the first degree, simple assault, a misdemeanor of the second degree, recklessly endangering another person, a misdemeanor of the second degree, fleeing police. As you heard, a police officer did arrive on scene and the car took off, as a misdemeanor of the second degree, careless driving, as well as reckless driving. And each of those assault charges that I talked about will go to each of those nurses. They each have their own set of charges for what happened to them. What happened here is completely unacceptable. It is offensive. These felony, the first degree charges, that's what we're going to charge someone who also did a shooting. Like, that's how crazy this behavior is. A felony, the first degree, is extremely serious. We look forward to vigorously prosecuting this person and the people involved in that shooting, and we're not going to stop until that case is solved as well. We enjoy the work that we're doing with the mayor's office, the police department, our federal partners, and we look forward to continue working with them on this case and all future cases. Thank you.
Good afternoon. I'm Kevin Mahoney, and I have the privilege of being the CEO of the Penn Health System. I first want to extend my thanks to the first person I called when this event happened, which was the mayor of Philadelphia. And Mayor Parker immediately said, "What do you need? How can I help? How can my city help?" As a citizen of Philadelphia, like Kevin, for a long time, it's so critical to me that we stay together. The energy that we've had over the last 72 hours as a city to find the bad guys, the energy we've had to support each other. I am so proud of my 48,000 employees who will do anything for anybody at any time. And as you've heard, for them to be on the line, being injured, when they are not just doing their job, they're doing a sacred job. We need to keep this energy going. We need to turn this bad thing into a good thing. Let's clean up the city, as the mayor said. Mostly, though, if you see a nurse, see somebody in scrubs, you saw the fire department go by them a cup of coffee, give them a wave, salute them, because they are doing God's work on earth. And I can't tell you the emotion that we felt Saturday morning for each other, the emotion that my team is still going through, because this trauma is going to be with them for a long time. So don't forget them. Keep everybody in your prayers. And I again want to extend my thanks to the mayor, the police commissioner, Managing Director Thiel, I mean, everyone coming together, the DA's office and everybody. On behalf of Penn Medicine, we appreciate your support. And if I could indulge for 1 second more, I want to introduce Nicole Hoke. Nicole is the Director of Nursing here at Penn Presbyterian, and she was on the front line from the beginning and has been living this. So on behalf of our 3 injured nurses, on behalf of the nurses and doctors behind us, on behalf of the 48,000 strong Penn Medicine employees, I just wanted you to hear directly from Nicole for a second.
Hi, good afternoon. My name is Nicole Hoke. I'm the Chief Nursing Officer for Penn Presbyterian Medical Center. And I want to take a second to thank all of the staff, many of them are behind me, who have continued not only to care for the gunshot wound victim, the patients that were currently in the ED, but also their colleagues at the same time, and have continued to work around the clock as they do every moment of every day since this horrible tragedy has happened on Saturday morning. They are truly the heroes, and I am and we are proud to stand here and represent them. Our whole workforce is shocked and saddened for our colleagues who were hurt on Saturday. And this is just the awful reminder of the risks that we take working on the front lines every day to care for our patients that need our help in our community. We know that violence against healthcare workers is at a crisis level. 44% of nurses have been subjected to physical violence, and 68% have reported verbal abuse. Saturday's event has shown us that our lives are at risk, and no one should come to work worried for their lives. We understand that change must happen on all levels, and at Penn Medicine, we have taken very big steps to make our workplace safer and to care for patients whose lives have been impacted by this horrible gun violence. But we also continue to need support from our local, state, and federal law enforcement, professional organizations, and our community partners to keep our colleagues safe and reverse the toll of gun violence. Thank you to my nurses, my physicians, and all of the staff. I cannot thank you enough.
So we'll take a few questions. Will we be releasing the video? That's very unlikely. That's very unlikely.
I don't know if this is for someone from the hospital, but has something like this ever happened? Like, we can see the urgency in everybody. Has this happened before where workers are coming to save or a gunshot victim and they get hit like this? Is this a first of its kind type of situation here at the hospital?
Violence happens to nurses every single day. This particular incident isn't that common, but violence and aggression, incivility, racism towards nurses and physicians and healthcare workers happens every single day, and it needs to stop.
Can you bring us back to that moment when everyone was working? How do you tell those nurses that are responding to keep going?
You don't have to tell them to keep going. They just do it. They're heroes. They step in, they take care of each other, they take care of people who are injured, whoever needs that help. They just step in. We don't need to tell them to do that.
They're obviously heroes. Guys are going in, begging for them to come out. I know you mentioned something about kind of workplace changes and making things safer. Has anything been discussed after this to do anything differently or any changes being made after this incident?
Absolutely. We immediately changed our protocols. We will no longer extricate a patient from a car without that car being turned off and the driver stepping out. Our security will handle all of that prior to any nurses, physicians, or technicians stepping in to help that patient, unfortunately.
Can you talk about the support from other hospitals for the nurses here? I know all of us know a nurse,
Yeah.
family, or friends. Talk about that support.
Absolutely. It really warmed our hearts. We got calls, we got phone calls, we had food sent over from our hospitals all around the region, and we can't thank them enough for our support, for their support.
All right, we're going to end it there. What?
Sorry, yeah, I have several questions. But,
Several. We don't do several. Maybe one.
You mentioned the guy drove off with the guy in the car.
No.
Did he,
They just drove out. The 3 individuals who arrived left in the car.
Okay, so
The one was a shooting victim who was remaining.
And I was also wondering if you could, speak to hit and runs in general in the city and whether this is kind of a catalyst to, more aggressively prosecute or.
Can I do this? I'd like to take that question offline because I think this is a moment of something that needs to have its own space, right? And not lump it into the normal. This was not a hit and run. This was something much more sinister and than a hit and run. And even though it was hit and runs are a significant incident across the city of Philadelphia, what happened today was an assault. What happened on Saturday was an assault. So let's not get off message. It was an assault that happened. Those individuals intentionally left the situation and intentionally saw those nurses in their way and hit them as they were exiting. And we're going to leave that in that as we talk about this event. All right, thank you, everybody. I appreciate you coming out. Thank you.